Thanks, Kiona, and welcome everybody. We're glad that you're here today. This is Shannon Studden from RHI, and I will be tag teaming today with Deborah Lane. So I'll get started, and in a couple minutes I'll hand it off to Deb. As you probably know, this may look familiar to a lot of you, that together RHI and the National Rural Health Resource Center are one of the leading technical assistance and knowledge centers in rural health in the country. And in partnership with the center, RHI connects rural health organizations with innovations that enhance the health of rural communities. And today, the focus of those innovations will be centered around marketing. So you may remember the concepts on this slide from the webinar that was done 2 months ago on marketing theory, led by Dr. Stephen Castleberry from the University of Minnesota Duluth. And in that webinar, he emphasized the importance of setting a solid foundation in order to be successful going forward as a network. You've got a good strategic plan, you've got a way to evaluate your progress towards your goals in your evaluation plan, and now it's time to continue to build on the work that you've done with these. So this webinar and the creation of your marketing plan is really about setting a good foundation for sustainability. Market planning is critical in order to make sure that you thoroughly understand your member needs, to ensure that the services you provide are ones that meet the needs of your members, and to spread messages to your stakeholders in ways that are effective and in ways that are meaningful to them. Let's take a minute and just kind of look at the big picture of this marketing effort that is currently underway. So today's webinar will walk you through the marketing plan toolkit, which, just like your strategic plan and your evaluation plan, will consist of a template for you to fill out, as well as a guide that has definitions, some really comprehensive background information and instructions, and a document that contains some sample marketing plans so that you can see how other networks have developed theirs. We've got the guide and the template down in the left-hand corner in the file share, and it'll also be available on our website, as Kiona said, within the next 24 hours. That sample document will be ready to go probably in about a month. So as soon as that's out, we'll let everybody know so that you can look at the sample document. So you'll remember that in June there was a webinar, kind of a context-setting webinar for marketing planning that, as I mentioned, Dr. Castleberry led. This month we're talking about the toolkit itself. The marketing plan due date is December 31st of this year. And this kind of continues the work that you did, as I said, on the strategic plan and the evaluation plan, but this isn't the end of the process. So we'll continue to build on all of this work with the business plan, which is due in the middle of next year, and the sustainability plan, which is due at the end of next year. So these are not separate pieces of work that you're doing. They're all designed to build on each other in order to set you up as well as possible for sustainability in the long run. So the objectives for today are to look at the major components of a marketing plan. Deb will be going over some approaches for identifying stakeholder needs and aligning your products and services to meet those needs. We'll also talk about some strategies for crafting impactful messages and tailoring communication to different audiences. And then we'll get into the nitty-gritty of the marketing plan itself and the template and show you the pieces of that. In our last webinar, you might remember learning or being reminded, if marketing is a familiar topic for you, that everything we do in marketing is based on the premise that we're there to discover and meet the needs of our network members and our partners. And when we say the word needs, that includes both reducing our network partners' pains or their bad outcomes, their risks and obstacles related to the jobs that they're working to do, as well as increasing their gains, so the outcomes that they want to achieve or the benefits that they're seeking. And a lot of the work that you do in preparation for your marketing plan includes really getting a clear understanding of these. A couple other kind of fundamental concepts to what we'll be talking about today. In the webinar in June, we learned the importance of segmentation. Market segment is a subgroup of all the potential partners that are out there. And organizations within each market segment have similar needs and, at least in theory, will respond in a similar way to a marketing plan that we create for them. So if you've got a market segment, the organizations in that segment or the individuals in that segment share one or more characteristics that cause them to have similar needs. For example, we might segment into groups by size. So you may have very large, and small size organizations. We might segment into type of entity, like you might have hospitals in one market segment, clinics in another market segment, and public health organizations in a different market segment. We don't have enough time and money to meet the needs of every segment, so instead we'll just choose a limited number to pursue or to target, and we call those, magically, target markets. For every target market that we choose, we'll create a unique marketing plan just for that target market. So this is kind of what the process of developing a marketing plan looks like at the highest level, and this is specific to the network development group. So at the very highest level, we can break this process down into 3 phases. Phase 1 is very straightforward. It's just about gathering your existing plans together, and in a minute we'll go through each of these in a little bit more detail. Phase 2 is about gathering information from your members and stakeholders, and this takes a significant amount of time and energy, and Deb will be walking through this in more detail in a minute. So that's kind of the preparation work. That's phase 2. And then phase 3 is about building your actual marketing plan based on the information you've gathered in phase 1 and in phase 2. So in the typical course of marketing plan development, a separate marketing plan is created for each target market. So you can see on this slide, we've got marketing plan 1, marketing plan 2, marketing plan 3, each of those designed specifically for a different target market. So typically, phase 3 would be repeated for each market segment that you've decided you want to pursue. For the purpose of this deliverable, however, you will be probably happy to know that your networks will be asked to complete a plan for just one target market. We certainly encourage you to continue the process and develop those plans for your other markets, but for the purposes of this deliverable, you're asked to create a marketing plan for your primary target market, and we'll talk about what that is in a minute here. So we'll go into more detail on all of these individual pieces. Here's a more detailed view of each of those phases. As I said, phase 1 is about gathering existing plans. So you just pull together the work plan that you've already created, the strategic plan you've already created, the evaluation plan you've already created. Some of you have a financial plan. If you've got that, great. If not, no sweat. That is not an issue, and you don't need to create one if you don't have one already. So it's just pulling together the work that you've already done. Phase 2 is about the preparation work, as I said, and you'll notice that in the who line, kind of underneath the header here, the who's involved in phase 2 is a large group of network stakeholders. So once you've gathered your stakeholder input, you and your network staff can create your marketing plan on your own. So in phase 3, now the group gets smaller again, and it's just network staff that's needed. You can certainly pull other people into it, but the most critical part of this whole process for you to get input from a large group of your stakeholders is in phase 2. So because your marketing plan is going to be based on this preparation work in phase 2, it's really critical to do this part well. And I'm going to hand it over to Deb, who's got some really valuable tools and some good strategies for getting the information that you need and for keeping stakeholders engaged in the process.
Thank you, Shannon. Preparatory work. Well, preparatory work is about questions. and more questions and more questions. But it's about finding answers to those questions. In one of the previous slides, we saw a concrete foundation. Representing the foundation, a market plan is to sustainability of your network. I did some research, and concrete is made of 3 main ingredients: water, aggregate, and cement. But the exact amount of each is unique to each application, the amount of use the structure will have, and the environment that it is in. The preparatory work that you will be doing as a network is about finding that magical formula for your foundation. What is the environment? What are the use factors? And the application to the different market segments. The analysis of these factors to determine that right formula is actually called a market analysis. And in this, you review and update your environmental scan. You identify and define the competitors. It's done by defining members' needs and what the network can do for your members. And it's about identifying market segments. I'd like to walk you through the details of phase 2. And you will need to involve, as Shannon said, a large group of members in this particular phase. It's not something that you as a leader or other staff can do on your own. You must get your members together. And this is a must in order to gain the kind of input to really understand them. The first step to do this is to look at your environmental scan. And this is done with that large group of members. Time to pull out that environmental scan that you did for your strategic plan and look at how things may have changed. Has anything changed in your environment since you first did it a year ago? And I'm betting that things have. Every time you go around that strategic planning cycle, every time something happens at the federal level or something happens at your local level, your environment actually changes. So which newly identified blocks and levers will impact the network and or the work that you're doing with your plan? And then what levers and blocks really are most critical as you move forward? In Appendices A, you will find a facilitation to help your network do this particular phase of this information gathering. And this will take approximately 30 minutes. In preparation for doing this part of your session together with your network leaders, it's best if you would take and transcribe those blocks on one flip chart and levers on another flip chart. Now, if you did a SWOT analysis instead of a blocks and levers for your strategic plan, you would use an individual flip chart for each of those elements. And this is all about discovery. So we want a blank flip chart next to each of those for you to write down the newly added blocks or levers or elements of that SWOT plan. There's an introduction, as you can see in the facilitation guide here. And in the center of the facilitation document, you're going to see some of those questions that I just talked about in one of the previous slides. It really will take you through the whole process, that whole discussion by a series of questions to discover any changes in your environment that's happened since you did your environmental scan. And following this simple process, you'll be able to confirm your past work and identify those new blocks and levers that you're working with within your environment. Well, the concept of competition may be new thinking for you. It's important to be aware that competitors are a part of all organizations. If your network was created to fill a gap in services, it might be tempting to conclude that your network has no competitors. This can be a risky assumption. Competitors can come in many forms. It could not only be another network, but any other individual group or organization or even technology that might be able to provide the same service that is offered by your network. Any entity that might meet the needs of your members, whether in the same way or a slightly different way, needs to be considered as a competitor. Now, I know a number of you are doing care coordination. Many of you are doing it through community health workers. Now, a competitor might be one of the case managers of one of the individual managed care organizations or one of the private insurance companies that works with the same market that you're looking at working with. So it's important to ask yourself questions like, who else can or might provide the services offered by my network? What are the alternative ways of accomplishing the same objective or accomplishing the same service? What is or why is your network the best choice? What are some of your competitive advantages? And what's happening within your network partners that could be signs of competition? And some of you, we've had that particular discussion as we've been talking on check-in calls when things are happening in different ways within your networks. Now, again, in Appendices B, we have a facilitation guide to lead you through this particular discussion, which asks those questions that we already just went over. But the answers to these questions should be recorded on a flip chart so your members can visually see them. And the biggest piece of that is that you're going to want to take and transfer them to this particular worksheet. So you have a documentation of all of those things that you talked about competitors. And kind of a FYI is putting this worksheet away in some place that you're going to remember it electronically or physically in paper, because when we move to the business plan, this is going to be a part of that business plan. So not only do you want to know who your competitors are as part of your environment when you're coming up with your plan here, your marketing plan, but you're going to need it for your business plan as well. All right, there we go. The third piece of this phase 2 is the most substantial, the product and service designer. If you were in attendance at the All Programs meeting at the end of February in Rockville, you've been introduced to this tool. It has 4 different phases or 4 steps to the product and service designer. It has your members' needs assessment, looking at and developing a product and service value map, identifying market segments, and finding the fit for those different market segments. This tool takes you through a process of looking at your members' needs, which is on the right, and then moving to the left by figuring out how your network can take and meet those specific needs. In Appendices C, you will find the Designing Products and Services for Networks worksheet. On page 1 of the worksheet is some foundational information that will really set the stage for the rest of your work. Your organizations that are part of your network, your mission, your vision, and some of your project goals. The first phase is that of the members' needs assessment. And in step 1, you want to list all of the jobs or tasks your members want to complete, and or the problems that they're trying to solve or the needs that they're trying to meet. Then we move on to look at what we've called pains and gains. And Dr. Castleberry began talking about these 2 months ago. So what are the pains and gains that your members experience? The pains are frustrations experienced while trying to achieve the goal, the job, or solve the problem. It's describing negative emotions, challenges, risks, undesired costs that members experience before, during, or after getting their job done or the problem solved. And we need to make sure that we quantify this. For example, a wait time of 10 minutes or having to re-enter information in 2 different spots. Now gains, those are the benefits and outcomes experienced while achieving the goal or the job or solving the problem. They describe the positive emotions, the functional utility, the social gains, and cost savings that members may experience or wish to experience either before, during, or after getting their work done. And for those of you doing care coordination, a gain is simply connecting people to community resources. And your answers to these questions for both jobs, pains, and gains are from an individual perspective, an individual person or member perspective. Now we move to the left side of the product and service designer. And that's learning about what your network can do in order to meet the needs of your individual organization. Now you've gathered a deeper understanding of your members' needs. So moving to the product and service side, you can see what your network can do to relieve those pains and create those gains. And on this side of the tool, you're looking at it from an individual organization on the members' needs assessment. You're looking at it from a network perspective or that of a whole. So step 2 is that product and service value map. Asking your network members present at your session to do your pre-work, you want them to brainstorm what your network can do to relieve the pains. How can the network eliminate or reduce the things that annoy them before, during, or after doing their jobs? And then asking, how do you create the gains? How can your network create outcomes or benefits that your members expect? And then moving to doing a synthesis or an analysis of those 2 and determining what are the products and services that your network can deliver based on those pain relievers and gain creators. And you will note that there's a spot for you to put your current services in as well. In the appendices, you will also find a facilitation for this entire worksheet. We have identified a method that will engage your members in recognizing their own needs and discovering which needs are appropriate for the network to meet. Now, this process is going to take you a minimum of 3 hours. So setting aside 4 hours is really the comfortable amount or the amount that we suggest that you set aside. The second page of this facilitation, you will find the market identification process. And this is to figure out what segments or what market segments can the network's products or services be offered to. Now remember, Shannon talked about a market segment as being a subgroup of people or organizations sharing one or more characteristics that cause them to have similar product or service needs. Your members can brainstorm these market segments on the worksheet. And so by the end of the 30 minutes it takes to walk through this facilitation, you will have identified several market segments and be able to work with your members to determine what that first and most important target market is. going back to the big picture of the product and service designer, in 3 to 4 hours, you will have garnered much information about your members. Enough information that you'll be able to determine exactly what that magic formula or recipe is for your foundation. The final piece of the worksheet will be that of finding the fit. And this is where you will take and combine all of the different pieces of those previous pages together. You will take and list where you see network products and services, replace it with one of those products and services that you identified during your product and service value mapping process. And then in the left-hand column, refer to your pain relievers and your pains and write down which pain relievers and which pains that product and service will address. And the same thing with the right-hand column. Which gain relievers will this product address, as well as which gains will it create for your members? Again, just simply referring back to the previous pages of your worksheet. In the instructions in the facilitation as well as in the worksheet, it talks about rating. Rating the pains, the gain creators, and pain relievers according to intensity. So it will be very helpful for you to take and write those numbers down as well when you're filling out this particular sheet of the entire worksheet, because that's how you know which key things to be using in your key messages. And that's what this sheet is for, is to help you develop your key messages, which is a part or one of the components of your marketing plan. Now, as you're ready to move to the marketing plan components themselves, when you start looking at that in the next month or two, and I really encourage you in the next month to really set a date to do this pre-work and get started on it, and you have any questions, and I know we're going over this really rapidly today, please feel free to connect with Shannon or I. That's what we're here for. So please feel free to reach out to us as we begin working on this marketing plan together. And with that, I'm going to let Shannon talk about how you use these pieces of this product and service designer in the different components of your marketing plan.
Thanks, Deb. Just a note to all of you, if you've listened to Deb and you're right now thinking, oh my gosh, that's only phase 2, this is going to be quite the process. I can assure you that phase 2 is definitely the most complicated part of this whole thing. It's the most critical part because it's the part that you'll be basing your marketing plan on. So once you start to actually build your marketing plan, that's really all about just picking the target market, the market that you're building the plan for, and just pulling the relevant information out of your preparatory work from stage 2. So there's not a whole lot of creation in the marketing plan. It's just more about just picking and choosing the information that you already have that's relevant for this particular market. So again, here's sort of just an overview of phase 3. This is often just done by network staff, by a handful of people, through incorporating information from your preparatory work, coming up with a plan to evaluate it, and identifying what needs to happen in order to do everything that you listed in your marketing plan. So here's an overview of the components of the plan itself. We've got and we'll go through each of these in detail. So we've got just your overview, an identification and definition of your target market. So what market are you focusing this plan on? What are the goals of your marketing plan? What's the marketing mix? And we'll talk about that in a minute. How are you going to evaluate the success of your marketing plan? And a couple of kind of final pieces that we'll talk about, the secondary target market and your key initiatives and next steps. Let's look at each of these in a little bit more detail. So the network and project overview piece is just pulling information that you already have, certainly in your strategic plan and probably in some of your other documents. I'm going to pull up the template so that you can see what this looks like. So the first page is just listing your network vision, your mission, and the goals of your HRSA grant project. Nothing new here. The reason that it starts with this is because this is, as you well know, the foundation for everything that you do. So it's any marketing plan done by any organization starts with its mission and vision, because the rest of the marketing plan has to always be tied back to what the big picture is that the organization is working to do. All right, so a target market. As we said now a few times, market segment is a subgroup of people or organizations. So you will, in the preparatory work, you will have broken your overall market down into unique market segments. And then on the marketing plan, you're asked to list all of those segments that you identified in your pre-work and to list them in rank order with the most important at the top. Let's take a look at what that looks like on the template. So that top box is for you to list the market segments that you identified. Choose your most important market segment at the top. For the purposes of this marketing plan, we'll be considering that your most important market. We'll be labeling that your primary target market. And then at the bottom of this page, the lower half is the spot for you to provide a summary of your primary target market's characteristics. So any relevant information, anything that has anything to do with marketing. It might be location, it might be organization size, it might be the population that your target market serves, any other important information that's going to factor into this marketing plan. Then look at your pre-work and pull out the jobs or the tasks specific to your primary target market. So you're going to be going back to your phase 2 work, your preparatory work, and looking at the list of the jobs and the pains and the gains and pulling out the ones that apply only to your target market. So you're not doing any new work here, you're just pulling out information from the pre-work that applies to your target market. On the next page, you're asked to list your goals for this marketing plan. So if you look back at the project goals that you listed on page 1 with your vision and your mission, you can determine which of these goals pertain to your target market. They may all pertain to your target market, or there just may be one or more of those goals that do. And if you look at your evaluation plan or your work plan that you will have gathered in preparation for this, you may see some goals that pertain specifically to your target market. So it's very possible that some of the goals already listed in your evaluation plan or your work plan could be directly transcribed into your marketing plan or just tweaked a little bit to be more specific to the marketing plan. Let's look at some examples. So in the first example, imagine that one of the primary goals of this project, this project funded through the HRSA grant, was to increase the number of community health workers in the state. So that was one of the project goals. One of the measures of success that the network listed on their evaluation plan could have been to increase the membership in the State Community Health Worker Association by 20%. So let's imagine that was one of the goals listed on their evaluation plan. Translated to the marketing plan, a marketing plan goal might be almost identical to that. So it might be to increase the state CHW Association membership by 20% through reaching out to the entities shown on this slide. So the providers, facilities, agencies, and so forth. In the second example, imagine that one of the goals of a different project was to increase access to mental health services in the community. So that was the goal of the project. And one of the measures of success identified on their evaluation plan may have been to increase the number of new patients seen by mental health providers. So this could translate to a marketing plan goal of increasing the number of new patients by, say, 15%, as we have on the slide, through increasing providers' awareness of a local mental health center. So you can kind of see how these goals most often are not created brand new. They're directly connected to a project goal and or an evaluation plan goal or a work plan goal. So it's just thinking about your target market, your marketing efforts, and how those connect to goals that you've already created. The next part of the marketing plan encompasses the marketing mix. Now we're getting into some marketing lingo here, so a marketing mix is a description of the way that the network plans to influence demand for its products or services. If you're familiar with the field of marketing, you may know there are a lot of different ways to look at the marketing mix. And if you're not familiar with it, but you Google it and do some more research on it, you'll see there are a lot of different ways to define, to break up the marketing mix. In this instance, we're going to keep it as simple as possible, and we're going to go with the most traditional way of looking at it through what's called the 4 Ps. We influence demand for the products and services our network offers by creating the right products and services, that's the first P, that meet member needs, developing key messages that are meaningful to our target market, that's our second P of promotion, identify the best way to deliver our products and services through the third P, which is place, and generate revenue in ways that cover the cost of delivering products and services. That's our fourth P is pricing. So let's look at each of these individually. So our first P is products and services, and here you're still not creating anything new. You're just pulling from your preparatory work in phase 2 anything that relates to your primary target market. So let's take a look at the marketing plan template and see what that looks like. So on this page, you've got space to lay out your marketing mix. You've got the spot on the top to list any existing products or services, just from the conversation that Deb walked you through a little bit ago. So what existing products or services does the network already offer, and how do they meet the needs of your members? Again, this is just pulling from your prep work. Then on the bottom, if any new products or services, any potential new things that you could do to meet member needs came up during those conversations, you would list those on the bottom half of the page and specify how those would meet member needs. So let's take a look at our second P. So we already looked at products and services, our first P. Let's look at our second P, web promotion. So how will you describe the ways that your products and services address pains and gains? And this is key, in ways that resonate with people in the target market. And what methods will you use to deliver your messages? You can use what you know from your prep work about your target market's pains and gains and jobs, and the current and new products and services your network offers to create these messages. Just as I will tell you, this is probably where the majority of the brain work goes when you're building your actual marketing plan. Let's take a look at what that could look like. So here's one example of what that could look like. It's almost a formula. For a specific product or service, consider the pains or gains it addresses. So you got a product or service, what pains or gains does it address, and how does it relate to the job that the member is working to do. You put those together and you get your key message. Let's take a look at an example from of something like this that a grantee from a previous cohort put together. So a product or service that the network offered was education on sexual violence. A pain for their network members, which was providers, was a lack of resources. A job that the member was trying to do was provider education. So they had a lack of resources, but they needed to provide education. Put those all together and you can create your key message. So one of their key messages was something very similar to this. It was our curriculum will provide the resources needed to educate clinical providers on the topic of sexual violence. ABC equals your message. This isn't the only way to create a message. This is just one tip, one strategy for creating these messages. Let's look at the template. I'll show you where that goes. So there's your key message spot on the template. What's the product or service? What's your key message? And how will you deliver that message? Again, it's important to be delivering that message in ways that are important to your target population. So if you've got a certain demographic, you've got older folks or younger folks, having the delivery method that resonates with them is important. If you've got people with access to technology versus limited access to technology, that's got to be an important consideration in the way that the message gets delivered. On to the third P, which is place. And the place is all about the mechanisms and the processes for delivering your product or service. And there are two pieces to this. The first is the delivery mechanism, consisting of things like in-person care coordination, asynchronous messaging between providers, telehealth consultation, 24/7 availability. That's how the product or the service gets delivered. What's the mechanism for delivery? The second aspect of place is made up of the internal workings and the internal structure that makes delivery possible. And it could include things like a specific staffing model, like having care coordinators stationed at each primary care clinic, having dedicated telemedicine rooms, or having agreements with transportation providers. So what is it about the structure and the arrangement inside your network that makes it possible to deliver your product and service? Flip over to the template. Here's the page for specifying information about your place. So what's the infrastructure? What are the workings of your network that make delivery of your service possible? And how does it get delivered? Let's briefly take a look at the last P, which is pricing. This is normally part of a marketing plan, but for many networks it's a little bit early in the 3-year grant period to really have a good handle on this. So if you have not yet created a financial plan, feel free to leave this section blank. A financial outlook is not required as part of your marketing plan, but it will be an expected part of your business plan. We've got more time to get that going. That's due closer to the end of the grant period in the middle of next year. If you do already have a financial plan, or you already know how you're going to be pricing your products and services to ensure sustainability, by all means describe it here if you'd like to, but this section is entirely optional. One of the last pieces of your marketing plan is an evaluation plan, outlining how you'll know whether your marketing efforts are giving you the results you're looking for. Let's pull up the template one more time, and we'll take a look at the evaluation plan. So for each of the marketing goals you identified earlier, you provide information in a very similar format to what you did when you created your evaluation plan. And in fact, if you have a marketing goal that's taken directly from your evaluation plan, you can just pull that evaluation plan information directly into here. So these columns should look familiar to you. It includes a description of the measure. Measures can be qualitative or quantitative. Provide a specific target or a benchmark comparison. So what are you shooting for? Are you shooting for increasing number of patients by 15%? What's that target? Define how the measure will be calculated and identify the method and the frequency of the data collection and the person responsible for gathering the data. As we said, you'll want to create a unique marketing plan for each market segment. And while we're just focusing on your primary target market for this grant deliverable, we want to at least get you started just thinking about how a marketing plan centered around that secondary target market could look. So in this section, you're just asked to identify your second priority market segment. So when you had that ordered list up in the early parts of this marketing plan. You had them rank ordered. So pull your number 2 market segment in here and just very briefly describe how a marketing plan for this market segment might look different than the plan for your primary target market. Again, there's no need to, for the purposes of this deliverable, there's no need to create a second marketing plan. You'll probably want to do that anyway. But for the purposes of this, it's just to have a couple of thoughts about how a different marketing plan for that market segment could look. And then the very last bit is to think about what needs to happen in the next 6 to 18 months to bring your marketing plan to life. So this is just a little bit of an action list. What communications do you need to have? What information do you need to get? What resources do you need? You might want to do a pilot test or a limited introduction of some of the things you identified in the marketing plan. And as always, list the person responsible for each and a timeline for completion. That is the process in a nutshell. So we've talked about the preparatory work. We've talked about the marketing plan itself. I guess now I throw it out and see if anybody has questions. If you've got questions, please put them in the chat box on the left-hand side of the screen, and I will turn it back over to Keone.
You can also press *2 to unmute to ask a question.
Thank you for that presentation, Shannon and Deb. It looks like we have David typing, so I'm just going to give a few moments for questions to come in or any comments.
Hi, this is Annette Carbonell from New Hampshire. I was unable to view the webinar. It would not connect for me.
Okay.
So will you be sending that out? I took a lot of notes, but I think without seeing what you were pointing to, it made it, I'd like to go back over it. So will we be able to receive that?
The webinar recording will be provided. We'll provide a link sent out via email, and in that link it will provide the webinar recording, podcast, and the slide deck and the template in the guide that they went over as well. So you'll have all of those documents. You'll be able to view the recording as well.
Thank you. Perfect.
Sorry about that, and that's a lot of information to take in just through your ears. That's a lot.
I wrote really fast.
Your question, David, is, and for all of you on the phone, we are very happy to look at a draft, a partial draft, anything that would be helpful to you. So please feel free to schedule a time with your TA provider from our staff or any of us. I'd be willing to work with anyone, as Shannon would be too.
Yeah, and as Deb said, at any point in the process, even if it's before you get started, just to more fully understand the template and the prep work, or if you just want to brainstorm some ideas, we are absolutely happy to do that at any point in your process.
And Cheryl was asking if there was a way to receive these documents prior to the start of the webinar so you could print and have them for future meetings. Thank you for that suggestion, Cheryl. We will take that into consideration when we do our next webinars. I think we can figure out how to do that. Other questions? Again, typing in the chat box or *2 to unmute.
Okay, I'm going to be respectful of everybody's time. I'm sorry, Deb, you can go if you have anything else.
What I was going to say is that there was a lot of information, and it may seem like a daunting task, but we've worked as a team really hard to give you the tools that break it down to be hopefully quite simple. So once, print that guide off and start looking at that guide and those facilitations. It really, you follow that